Yes, are you afraid of the dentist like I am? Well, you shouldn't be, because we're going to show you why. In fact, a number of Americans are afraid, and they don't go to the dentist, and they really need to, because it is so important. With us today is dentist Dr. Bill Dorfman. He's going to explain this latest technology. He's got a patient with us here today, Adrian. Tell us what this is all about.
Well, here's the deal. 40 million people don't go to the dentist, not because they're afraid of dentistry, they're afraid of the pain from the injection.
The Novocaine injection, the shot.
Yeah. It's not even actually Novocaine, it's lidocaine, but whatever. So we've got a new device,
as long as it works,
which is FDA approved. It's called the Dental Vibe. And the thing that's cool about this, vibrates. So let me tell you what happens.
Oh, but it makes noise.
It does. It makes noise, which distracts you also. But the way that this works technically is that the vibration travels to your brain faster than the pain from the injection. So when that vibration signal gets in your pain, it shuts the pain gateway, so you don't feel the pain, you just feel the vibration. So I'm going to demonstrate with Adrian here.
Hi, Adrian.
Hi, Adrian. Good luck. I'll see you later.
So
We're just going to give him a little injection.
Are you normally very afraid of getting shots at the dentist?
I am a little.
Very
Did you
afraid.
volunteer for this job, by the way?
How
Did you volunteer?
How did you get dragged into this?
I don't like the pain of the injection.
He's a sweepstakes winner.
Okay,
We need to do it. We're going to do a filling on him today anyhow, so I figured I might as well numb him up for you guys and then go fill us too.
Okay, so we're going to actually see this in action now. So
right
everybody,
now.
please be still and be quiet, because we don't want.
All right.
And if at home you're a little bit, if you're a little bit squeamish at home.
So what happens
yes, if you're
is-
squeamish at home, please turn away.
Let me tell you what happens. First of all, we have the vibration going, okay? It also has a sound distraction, okay? What I'm going to do is I'm going to give him a little injection right here. Just like that.
Did you feel the shot?
I didn't feel anything. Nothing.
Really? You see, it works. Wow.
That's fantastic.
Okay,
Give me a shot in my hand.
So let me ask you. So then, is this device widely available?
Like a Jaeger, what do you want?
Dentists can get this all over the country. It's really easy to use. It's not very expensive. The dentist buys it. It's just like regular equipment that you keep in your dental office.
So it's not like you would have to be charged more in order to have that.
And here's the cool thing about this. This is FDA approved, okay? And I know the inventor, and they're working on a new model that you can use for things like, I know you don't do Botox or fillers or anything like that, but one day when you have to, they're making a device just like this that they'll be able to use for extraoral injections on your body and things like that, which is also very cool.
That's really neat. And what other things can we do in terms of just anxiety?
Well, as far as anxiety is concerned, I mean, if you're really petrified of going to the dentist, we can put you to sleep. You know, and I have patients that come and say, Doc, I don't care what it costs, put me to sleep, wake me up, and I'll be done. We can do that. We can do sedation dentistry with just pills, oral sedation, where you're kind of sleepy, you just really relax, and it gives you a really great amnesic effect. And then we can use nitrous oxide, laughing gas.
Sure.
Okay, now we have some other products
By the way,
here.
Lamar Odom, my son-in-law here, scared to death of the doctor.
Send him in.
Doesn't matter how
He has 2
manly you
NBA
are.
rings.
Doesn't matter
He
how
sees a
manly you
needle.
are.
Boom! Right, he's out cold. Yeah.
So you brought some other products here, because a lot of people are really curious about like cosmetic things, not just actual dentistry, but whitening your teeth.
Whitening.
There's our everybody. So our first clue was chevron, and our second clue is whitening. So you need those 2 clue words to enter the sweepstakes today.
All right. Well, let me give you the lowdown whitening real quick, because we're running out of time. The best way to get your teeth their whitest, safest, fastest, and all that is to go to the dentist and do the in-office Zoom system, light activated. I have some pictures I can show you of patients that have had their teeth whitened with Zoom. And, that's fast. You get 8 shades in a little bit less than an hour. Yeah, this is smoking, and we take off the smoking stain. Let's see, there's one more we have. This is just genetics. Somebody born with yellow teeth, we can make them white. And the final one is, I think, tetracycline stain. Sometimes if you take tetracycline as a kid, your teeth get dark. So that's probably the best one. The next best would be in your dental office if you're going to use the trays with a gel.
That you take home.
But you still have to do something, okay? Then when we go to the over-the-counter, you really have 2 options. The first are the strips. And the strips work. I mean, they get your teeth whiter. Not as white as Zoom will do, but they do work.
Good, try it.
Okay? And, but some people don't like the fact fact that they're messy and they have to do something and all that. That's why they'd rather go to Zoom and get instant gratification. But the big misnomer is whitening toothpaste. And let me explain one thing about the whitening toothpaste. Whitening toothpaste don't whiten your teeth. All these other systems, just listen. All these other systems actually change the color of your tooth. All a whitening toothpaste will do is take stain off your teeth. So you have to be really careful with the whitening toothpaste, because if they're really abrasive, you're going to damage your teeth. So make sure it's ADA approved. That's the American Dental Association approved before you use any dental product.
Okay, great. Well, that's very great info. Thank you so much.
You got to take us to break with that.
The doctor just told me that he is. Do you want to reveal?
I have no problem with it.
What?
He's 54 years old.
No, you are not.
Adrian.
Seriously?
You look
so he comes on the show.
He's injected his face with that. Just relaxed.
He's just relaxed.
I'm so awful. I'm sitting here in glitter.
Here's the deal. Never drink, never do drugs, exercise every day, and don't go in the sun.
There you go.
And good genes, I guess.
And then you look like this when you're 54.
Good genes, most important.
Well, thank you all
for
being
three.
here.